going to be your nurse today. First, I'm going to go ahead and log into my patient's medical record on SIM EMR. All right, and I'm just going to be verifying the provider's order for the CVL Dressing Change. So I'm going to go to my patient. All right, I see that I did verify my order, so I'm going to go ahead and introduce myself to my patient. My name's Taylor. I'm going to be your nurse today. I'm going to be performing the dressing change for your central line. Do you have any questions for me? All right, and then I'm going to get you to verify your name and date of birth for me. I would check that with the wristband as well as my medical record just to make sure that it matches. All right, and that we will proceed. All right, so I'm going to go ahead and hand hygiene and gather all my equipment. I'm just going to go ahead and remove my badge. Okay, I'm just going to go ahead and close the curtain at this time if my client had one, and just raise the bed and my table to like a working height. And open my sterile package to remove my mask. Alright, and I'm going to apply a pair of clean gloves just to remove the previous dressing. At this time, I would just get my patient to turn their head away from the incision site, and if they're not able to, I would apply a mask on them at this time. So I'm going to go ahead and reveal the dressing. Alright, and to remove it, we're just going to start at the bottom, pulling at the edges perpendicular towards the insertion site to the skin. And we're just going to secure the catheter as well, just to make sure it does not become misplaced. At this time, I would just observe for any swelling, inflammation, or drainage. I'm going to go ahead and discard of the supplies appropriately. Next, I'm going to go ahead and hand hygiene. All right, and I'm going to go ahead and proceed to open up my sterile package using sterile technique. All right, I'm going to grab my sterile gloves and apply. And typically you would have a pair of sterile gloves in this pack. I unfortunately broke mine, but for the purpose of this validation, I'll be using regular clean gloves in the place of them. So I'm going to start with my dominant hand. Right, and then my non-dominant. So now I'm going to get the chlorhexidine and go ahead and clean my patient. We're going to use a back and forth motion and secure the catheter if needed to make sure it doesn't come misplaced. All right, then we'll dispose of that appropriately. I'm now going to grab my new dressing from the pack, and we're going to go ahead and apply this over the insertion site. And once that is on there very well, we're now going to just dispose of our gloves and our mask. And I would throw that in the trash can. And now we're going to go ahead and label the new dressing with the date, time, and initials. And once that has been done, now we're just going to go ahead and fix our room back to how it was and check on our patient. So we're going to dispose of all these supplies appropriately. Lower my bed back down, make sure my call light's in reach. Alright, I'm going to go ahead and log out of my medical record. Can I get you anything at the moment? Alright, I would check on my patient. I would hand hygiene on my way out, and that would be it.